Our final present for this session is Dr. Rathnamala Desai. She will be presenting her research titled Collaborative Approaches for Eliminating Cervical Cancer in Rural Communities. Evidence from Dharwad District, Karnataka, India. Dr. Rathnamala Desai is a principal of SDM College of Medical Sciences, Dharwad, Karnataka, India. She is the president of the Family Planning Association India and member of the Board of Trustees of International Planned Parenthood Federation. Dr. Rathnamala, over.
Good afternoon, ladies and gentlemen. I thank the ReproSex organizing committee for having given me a chance to talk here because the principal investigator could not come due to certain unavoidable circumstances. And I stand before you as the president of Family Planning Association of India. This is not a real research project as such, but it is the work we have done, and we are presenting the work we have done and how we have done. So this is a collaborative approaches for eliminating cervical cancer in rural communities, evidence from Dharwad District. India is a large country with a huge population, and we do not have free vaccine. I understand that Sri Lanka has got free vaccination for HPV vaccine, but we do not have free vaccination. However, our finance minister did promise in the last budget that they would provide a separate allocation of budget for HPV vaccine, but it is not yet materialized. So we have to procure vaccine, and then we have to give it. And as you know, FPA is an NGO, and we work in 40 centers across India. And we are providing contraceptive services. Other than that, we also are doing cancer screening. And also we are planning to give a complete treatment like vaccination, screening, and treatment of pre-invasive lesions. The first step for us is to mobilize resources to procure the vaccination. And who are our donors? Our donors are the corporate sector, where they give their corporate social responsibility as a part of that budget. They give us money. The NGOs like Rotary, and of course certain community leaders who give us donation. Now it's not enough that we procure the vaccine. When we go to the village, the people, the parents, they are not very forthcoming to accept the vaccine, even though we are ready to give it as free. And when we go to the schools, it is a different story because there we need parents' consent. So the parents are not there in the school, and teachers are not ready to take the responsibility, and they should not be also, but they ask for too many permissions. So we have had difficulty in working in schools as well. So what we have done is that not only we got donations from the corporate sector and the community leaders, but our workers went into the field and they created awareness among the public, among the parents, amongst the community leaders, among the panchayat leaders, explain to them what is cancer cervix, what are the consequences of cancer cervix, and how you could prevent cancer cervix. So we involved the community in educating them and creating awareness, and that's how we could get their children to come and get the vaccination. So what we did was the healthcare providers, the community leaders, the parents, together, all are a part of this program. All are part of this program where we involved everybody to create awareness and to prevent cancer cervix by giving vaccination and to screen the women. So not only we vaccinated children from 9 to 14 years, but we asked the mothers to come along with those children. So the mothers were screened and the children were vaccinated. And not only with that, When we screened the mothers, whenever there was a pre-invasive lesion, we took them to our hospital, took them to our clinic and treated these by colposcopy directed biopsy or a cryo, whatever was required. So we completed the circle in the sense we gave vaccination, we screened the mother and treated the pre-invasive lesions. So here we try to do what the WHO recommended, that you have to vaccinate 90% of the women, we have to 90% of the children you have to vaccinate, 70% of them have to be screened, and 90% have to be treated. So here I would like to give one example of one village where our healthcare workers went to explain to them. We had procured the vaccine by a corporate sector. We went to that village, we talked to them, we gave them health awareness, but there was not much of a response from the community. Then we talked to the community leaders, the panchayat president and the panchayat members. And then the panchayat president took the responsibility to go to each and every house and explain to them the advantage of getting the vaccine, which was being given free of cost. And the next day, the panchayat leader himself sponsored for 80 girls to give the vaccine. We gave the vaccine for 80 girls by the sponsorship of the panchayat leader, but then another 14 girls came. Then we didn't know what to do. But the remaining 15 members of the panchayat agreed to sponsor these children. And then we had screened all those women in that village for precancerous lesions. And then we treated about 7 of them, and we declared this village as a cancer-free village, cervical cancer-free village. So this is how Family Planning Association of India is working, where we are trying to give vaccination, where we are trying to detect precancerous lesions and also treat the precancerous lesions.